Hi viewers, welcome to Majesty Christian Television Network. My name is Apostle Helen Rudokino, and this wonderful day we are going to have a very interesting broadcast with you, and we encourage that you join us on www.majestytv.org, and then make sure that you also call on 023374160, because this topic is very interesting. It's going to enhance your look and give you a more healthy lifestyle. So we are having one-on-one with Dr. Yanni Van Logan, who is a surgeon here.
Not a surgeon, aesthetic physician.
Aesthetic physician.
Yes, aesthetic
All right.
physician.
So that means aesthetic medicine is a new aspect of medicine.
That's true.
And
yeah.
it is fast flowing, it's fast growing, and then you are the the vice chairman of the Dutch Society of Cosmetic Medicine.
Exactly.
All right. So, and you are practicing with Doctors Inc. That is your practice.
That's correct.
You are the director of Doctors Inc.
Yes.
Are you?
Yes, I'm the medical director of Doctors Inc.
Yeah.
It's a aesthetic clinic in the
Yes.
center of Amsterdam.
Yes.
And I'm a aesthetic physician.
Aesthetic physician.
So I'm not a aesthetic surgeon.
No.
There's a difference between an aesthetic physician
Yeah.
and an aesthetic surgeon.
Yes. Okay.
In my clinic, I have a plastic surgeon, an oculoplastic surgeon, who is originally an ophthalmologist, which is a surgical specialty, also like plastic surgery.
Yeah.
And I have one ENT surgeon, so ear, nose, and throat surgeon. And all these surgical specialties, they can do cosmetic surgery.
Cosmetic surgery. Okay.
What I'm doing
Yeah.
is what I've specialized in is aesthetic medicine. So this is basically, it's non-surgical,
Okay.
or let's say minimally invasive, which means that even though sometimes I have to use the knife, the blade,
Yeah.
for making a small
small-
incision into the skin,
Okay.
I generally try to avoid using the blade.
Okay.
So I work a lot with needles,
Needles.
with lasers, with chemical peels, with energy-based devices to enhance beauty in a non-surgical or minimally invasive way.
All right. So we are going to take this one by one.
Okay.
So we want our audience to understand that you are an aesthetic
Physician.
physician.
Yes.
Aesthetic physician.
I'm a doctor, and
Right.
I'm focusing really on the, let's say, minimally invasive treatments. And so,
So that means you are not involved with surgery. You don't use the knife. You don't use the blade. You sparingly use those things.
yes, sparingly.
Okay, but
On the other hand, in my clinic, I have surgeons working who cover that.
yeah.
Which they are the kings of the surgery.
Yes.
And you know, I think that every doctor has to focus on one thing.
Yes.
If you want to be a very, very good surgeon,
Yeah.
don't inject fillers, because filler injections, this is a real, true profession in itself.
Okay.
If you inject maybe one afternoon per week, you don't really know what you're doing.
Okay.
You have to do it every day to really know the little details.
Okay. We will come to that,
Yeah.
Dr. Yanni.
Yes.
So what we want the layman to understand is that we are going to talk today on how to enhance your facial outlooks, because the way you look can tell a lot about who you are. And I see that just like the fashion is going so crazy now, so people are also doing everything to enhance their looks. True or false?
Absolutely.
And then today we want to focus on the areas where we can reduce some fat. Is that?
Yeah, well,
Are we going to inject some fat, or are we going to reduce some fat?
so people somehow have the idea that fat is evil.
Yeah, exactly.
But in reality,
Yeah.
fat is amazing.
Really?
Of course, a lot of people have a little bit too much.
Yeah.
But if you grow older, the aging process takes away a lot of fat from the face.
Yes, it's true. Oh, you are talking to me. And
Yes.
then the face now slacks.
Yes, so you get it in the belly, but you get reduced in the face. So you see especially the hollow cheeks. You see more hollow eyes, the bags underneath the eyes. This is all has to do with volume loss, and also the hollowness of the temples. And even there is a little concavity in the forehead.
Yes.
It's because of volume loss. And it's not just fat that is being lost. There's a lot of other tissues as well that are reducing in volume. So we have also one of the most important volume loss tissues is bone.
The bone.
So of course we have our skull, and the skull becomes smaller.
Yes.
The facial bones become thinner, and especially in certain areas.
All right. So this is this is becoming very, very fearing, and I think very interesting too, because
This is the normal aging process.
really,
It happens with everyone if we keep on living, at least.
yeah, exactly. So now we are going to, for the sake of those who are watching us outside, we are going to ask you some little or specific questions, and then you can just take your time to
Okay.
answer.
Okay.
So the first question is it true that facial we can improve our facial outlook? Is it true?
Absolutely.
How?
Absolutely. So,
How?
first of all, there are changes in the face
Yes, that we would like to know.
in the aging process that we can correct.
Okay.
Then there are changes in the face that have occurred because of external factors like smoking, a lot of sun exposure, stuff like that. Also diet, and all these things we can address. Sometimes when a person has aged tremendously and the cheeks have moved forward and the eyelids are sagging,
Yeah.
then it's necessary to do surgery. Because to resect some skin and to lift, for example, the cheeks,
Yeah.
can reposition the cheeks to their original position.
Oh, really?
And so,
Really?
so this is what our surgeons do. But if you are, for example, not ready for surgery, or it's not necessary yet, then a non-surgical approach
Yes.
could be a good solution.
Approach, yes.
And so there's different possibilities. First of all,
Now let's talk about
Sorry.
Dr. Yanni.
Yes.
Let's talk about some of the changes that occur, because you've said something about the cheeks becoming forward. What do you mean by that?
that means that you've seen it. When you think about an old person,
Yeah.
you've seen that the cheek
Yeah,
is
the
kind of
cheek.
moving forward. The nasolabial folds increase because the cheek is hanging down.
Oh.
Also, the jowls become more visible. So there's a migration
Yes.
from
where?
from the ear to the
Migration.
mouth. That's actually
So
maybe a
this
medical
is
term.
not just a physical migration. Somebody out there listening to this broadcast is becoming interesting. So this is Dr. Yanni Van Logen discussing, having 101 with us, discussing on how to improve your looks, you know. So if you know that your chins and your cheeks are beginning to sag, please, you can contact the doctor. He is here because he is going to give your face that is now having some migration. Your chin, I've just heard a word that the cheek is migrating towards the nose.
It's a migration, yeah. We call it a lateral medial migration of soft
Really?
tissue. Yes.
Please permit me, I'm laughing too much. So it is very obvious that everybody must have that migration.
Eventually we'll have it, every one of us. And one of the most important things is volume loss.
Volume loss.
But then, of course, there's also laxity of the skin. The skin becomes thinner due to loss of collagen, most importantly. And the thin skin allows the fat to kind of slide forward better.
Yes. 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 So at what age do people begin to notice some of these changes? Because I think if we can arrest this thing earlier,
So you're talking about prevention.
is it not good?
Yes, of
So
course.
that people don't
Of
age.
course.
Because I wake up in the morning and see that I'm beginning to have some coughs here, and I don't want that. You know.
So
At what age can one begin to embark on preventing some of these things?
yeah. So if you talk about prevention of signs of aging, then I think my patients start to notice the little lines, the little volume loss
Yeah.
in the beginning of the 30s.
30s.
Yes.
Really?
But it depends on the reason that they're coming.
Yeah.
Some people want to prevent aging or reduce aging, but other people want to improve beauty. There's a little bit of a different approach.
Tell us.
If you think about beauty, if you think about what makes a beautiful face,
Yeah.
we all recognize beauty.
Tell us, because you will be the best to tell us. Maybe what, because there's this adage that says, beauty is in the eye of the beholder.
Yes.
But no, I don't think so.
Actually, I don't think so either. I think beauty is something. Of course, it is it is. How can you describe beauty? Of course, it's a process. We see a face, and it gives us a certain feeling. The face seems balanced. Seems like it's correct somehow, without flaws or with very little flaws. But what makes a face beautiful? And I think it's about proportions.
Proportions.
So the proportions of the different elements in
Yeah,
the face, the
yeah.
shapes
Yeah.
in the face.
Yeah.
If you think about some celebrities that have over injected their lips or over injected
Yes.
their cheeks, we've all seen them, and then we say, wow, that's not beautiful. This is not beauty. So if you have cheeks that are too big,
Yes.
it's out of proportion.
Yes.
There's no harmony. So true beauty is about harmony and proportions.
Yeah, okay.
And there's different scientific ideas about that. And the one scientific idea that I like the most
Yes.
is the golden ratio.
What does that mean?
So the golden ratio is actually a mathematical ratio. It's 1 to the 1.618.
Hmm.
So 1 and then to the 1.618. And I won't go into the mathematics of it. It's a derivative of the Fibonacci sequence.
Okay.
But it's funny that Michelangelo already used it
Oh.
in his paintings.
Okay.
And Da Vinci used it in his paintings. And even the old Egyptians,
Yes.
in their temples, they used the golden ratio to make the temples look beautiful.
Oh.
Because somehow this ratio triggers the mind.
Okay.
It makes the mind go, yes, this looks good.
So how do we look into the camera and please explain to us how we can identify that ratio? Do you have any of the any of your pictures or the this thing we would have streamed to
Actually,
let us see how to identify?
I haven't given you one of the pictures for the golden ratio.
Yes.
And I haven't brought my golden ratio calipers because
Okay.
I have a special instrument with which I can measure in the face the golden ratio.
Really?
I should have brought it.
What
I'm
do you
sorry.
specifically measure so that somebody who is out there can really grab this one?
Mm-hmm.
What do you specifically measure? Is it from here to here?
Yes, yes. So
Act one.
can I show you on your face? Or not?
do, yes.
Okay. So you have basically two numbers. One is the 1 and one is the 1.6.
1.6.
Okay. The 1 is the distance between your eyes, the intercanthal distance.
Yeah,
That's
yeah,
1.
yeah.
Then the 1.6 is the width of the mouth. It's also the length of the nose. And the 1 is also the width of the nose. So, and also if you look at the brows, a brow has a beginning,
And the
a
end.
peak,
Yeah.
and an end.
Yeah.
The peak is not in the middle.
Oh.
The peak is at 1, while the end is at 1.6. So, look at the camera. So, this is the beginning of the brow. This is the 1, the distance from the beginning of the brow to the peak of the brow should be the same, 1. Whereas the 1.6 should be the tail of the brow. So this is the 1, and the 1.6 should be also exactly the same width as the mouth and the length of the nose. And also, very importantly, the 1.6, which is the width of the mouth, is also the distance from the nose to a special point here on the cheek. So the 1.6 from the nose, and it's also from the canthus of the eye, to a special point here on the cheek. This is a magic point. If you give this a little bit more projection, it gives that beautiful, glamorous look. This is this is where I give my patients the secret sexy injection point. So if you enhance that look, you get the what. If you look at the fashion models, if you analyze their face, they have this beautiful little projection of their cheek.
Yeah. It's true.
So I give a little filler there, and that really enhances facial beauty.
Wow, this is awesome, really. So the way the faces of the Caucasians, the way their face outlook, their faces are quite different from the way the black race. So each of the species, you have a way of measuring the golden.
Yeah.
The golden
ratio.
Yes.
Actually, there's I think the golden ratio goes beyond races.
Okay.
With any race, if you accentuate the golden ratio in a face, it will make that person look more attractive.
Okay.
So if you're black or white or Asian or Latin American, if you accentuate the golden ratio in the face, you will make the face look more beautiful.
Beautiful. So if somebody would want to enhance the face now, where would you start, Dr. Yanni? Where would you start? Like, I've come now to your clinic. Okay, so many things are about to begin to sag. Where do you start? Is it from here, or is it from here, or is it from here?
So first thing I do is I ask you what you would want.
Yes.
Because this is very important.
Okay, do you have some things to show? Do you have some things some album to show for people to make their selection on the sort of face they will want to have?
So if a person wants surgery, I send them to my colleague for surgery. If a patient wants injectable or fat, then I do the consultation with the patient.
I think injectable or fat would be the most natural, because it leaves you with the natural look. You didn't tamper with your nose or whatever, only that you injected something to push it out. Is that what you mean?
Exactly.
Okay, like the lips, because I've seen some celebrities, they have very thick lips.
Yes.
Sometimes it gets me offended, because I see a man and then he has pumped the lips. Do you do that too?
Well, I do inject the lips, but I...
So the proportion.
I keep in mind the ideal proportions.
The
harmony of the face is important.
It is very, very, very. But there are some who will want it to be extra.
So if you
extraordinary.
if you would come to me and ask me, okay, what would you advise me to do?
Yes.
Then I will make a top-down analysis of the face.
Okay.
A lot of people, they have an idea about what they can do to enhance their beauty, because it's your own face. You see it every day in the mirror. You have an idea what you could do. For example, some wrinkles you might have. You think, if they're reduced, then I look much better. So first I try to explain that beauty is not only reducing wrinkles. It is improving the entire face.
It's true.
And so I make a diagnosis of all the areas in the face where I see signs of aging.
Okay.
And then I make a treatment plan. A lot of this treatment is giving back lost volume. And you can do that with fillers, you can do it with biostimulatory products, and you can do it with your own fat.
Okay. So the treatment you give is if you want to, the first analysis is to what? To
So I look at the skin.
Yes.
I feel the skin to see if there is any collagen loss. I look at the fat distribution.
Wow.
And I look for signs of bone resorption. And I look at proportions.
Proportions, yes.
So if a patient has like a lump on the nose or not a straight nose, I can make a plan to put some filler on each side of the bump, of the hump, and that will make the nose straight. If the patient has very deflated cheeks, okay, I give a little bit of volume in the cheeks, so etc., etc.
Yeah. So how often can one be uh, doing some of these fillings?
How often?
Yes. Like
Well,
like if you do the first one, is the first one enough to boost my outlook? Is it yeah? Is it my features? Is it good enough to make me get the desired look that I want?
So it depends a little bit on the person. You know, some people want the entire treatment at once,
Oh, okay.
and some people want very slowly to come back every few months
Yes.
to improve a little bit more.
Yeah, yeah.
And that is with fillers. With fat, usually I do one treatment, because with fat you have to do a liposuction first, and then collect the fat, and then re-inject it. And so that's a bigger treatment, but it's actually a beautiful treatment, because the fat, like I said, is not evil. The fat is where you can create true beauty with. And actually, I have prepared a few pictures that show how the procedure is done. And so it is, I think this is the future. And especially the stem cells within the fat are giving you, if you get, like, for example, fat in the face, a very beautiful and healthy skin. I've seen that in many patients now. So you can show one picture if you like. I use a specific device for fat collection.
Yes.
And this device sprays a jet of water into the fat tissue, and it loosens up the fat cells. So if you want to show that picture, the first one, yeah. So I start with marking of the area of where the patient doesn't want to have
fat.
the fat. Well, wants to, you know, everybody has a little bit of you know, places where there is some fat that they actually don't really want to have it.
Yeah, it's true.
Yes,
It's true.
Everybody has a place like this. So then I make a plan to reduce the fat there. So you can go to the next one.
Wait. So can you do this as well for a man?
For a man?
Yeah, or is it
Absolutely.
only for women?
No, this is for men and women. Yes.
Okay, let's go to the next.
So then I make a very small incision in the skin, and through that opening I introduce a very thin cannula. It's a blunt cannula, so it's not a sharp cutting instrument, but it's a blunt cannula. It's about 1.8 millimeters in thickness. And it sprays a water spray into the tissue, and it is here you can see that I'm actually going into the skin, into the fat tissue, and I'm spraying a local anesthetic.
Yeah.
And the spray of the water is with a specific hardness. So it is hard enough to loosen the fat cells out of the tissue, but it is soft enough to leave all the other structures intact. So blood vessels, nerves, etc., they all stay intact. And that makes this a very elegant method.
Jesus.
Were you shocked just now?
Yeah.
Was it the cannula inside the...
Yes.
Yeah, maybe that was a bit...
The doctors are really...
Sorry about that.
No, it's okay. It's okay. It's part of it.
It's part of it, yes.
Yeah.
So you see the sterile drapes. You know, this is actually, you could call this a surgical procedure.
Yeah.
Because we have to do it under, you know, sterile conditions. And of course, we do this in cooperation with our plastic surgeon.
All right. But this has to do with the belly.
This is
This is
taking
just
the fat, taking the fat.
Taking the fat from the belly, then to where? Where do you transport this fat to?
So this is first the infiltration, so this is anesthesia. Then I change the cannula, and the cannula that I change to does not only spray water,
Yeah.
but it also has little holes to aspirate the fat.
Okay.
Then the fat gets aspirated through a tube and collected into a small container. So,
Yes.
so here you can see on this image, you can see the spray, the water
This
spray,
doctor
and you
is
can see
incredible.
in the end of the cannula these little holes in the cannula.
Yeah.
And those are the aspiration holes that through which the fat cells get aspirated. So if you go to the next image, you can see that here with this cannula,
Yeah.
I do the same area again, and now I do an aspiration. So I take the fat cells that I've loosened up with this water spray, this water jet,
Yeah.
and I kind of like gently aspirate them. So it's basically a liposuction, but in a very gentle way.
Yeah.
And the reason it must be so gentle is that
Yes, I can see.
is the fat cells, they need to survive. This is live tissue.
Mm-hmm.
And if you want to transplant live
Yes,
tissue,
yes.
you shouldn't damage it too much.
Okay.
And there's even more to it.
So where would you transplant this one to now? The fats you've sucked out.
Mm-hmm.
Where would you transplant it to?
Well,
I want you to use the face because that's what we are talking about today.
mm-hmm, mm-hmm.
So where would you use this fat to?
So the fat I use usually for injecting on the places where I see there's a lot of volume loss.
Oh,
So
this is beautiful.
if you look at the...
Huh? So please hold on. So that means you can take some fat from me
Yes.
and recycle it.
Well,
That's what it
transplant
it
it to your own
transplant
body.
it to my own body.
Yes.
But can you take fat from me to give to somebody else?
No.
Okay. Can somebody give to me?
No.
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 Okay.
Maybe in the future, but definitely not now.
All right. Okay. So if you take the fat from the stomach,
Mm-hmm.
you can use it on the face.
Yes.
What about the fat from the backside?
The buttocks.
The backside, does it really have fat or is something else?
Well, there's of course a big muscle,
Oh,
the gluteus muscle, but but especially black people don't have this problem. They have beautiful backsides, but
sometimes it's big.
but sometimes they're or maybe sometimes it's big.
Yeah.
But a lot of my patients that want an improvement of the buttocks is because they feel that their buttocks aren't big enough.
Really?
They want to have yes,
a contour.
yeah, and they want a better shape. So, like I said, with the face, with the proportions, the same goes for the body. So, if you look at the ideal proportions of the body, there's also the golden ratio that you can use for, let's say, sculpting the body. So, if you go to the next image, you can see that
Jesus.
that there is a lipocollector.
Yes.
And this is what it looks like. So you can see on the top, you see the yellow stuff.
Mm-hmm.
That is actually the fat. And this is very, very pure, healthy fat because of the gentle way it's been aspirated. It is very healthy, undamaged, and in very small particles. These are very tiny fat lobules of about 1 millimeter in diameter. And this is really important for the survival chances of the fat, because once the fat gets injected into the target tissue, let's say the face or the buttocks or the breasts, then it needs to find a blood supply. We are talking about
It's true.
tissue that is alive. So if you have a big lump of fat and you would place it somewhere into the body, like a big ball of fat, then maybe the outside of that fat transplant, that gets some oxygen from the surrounding tissue and some blood and some nutrients. But the inside, the core of that big lobule does not get anything. So that dies. And so that's why it's important to have very small particles and place them in all different depths, and so that all these particles can get a blood supply.
Awesome. I am so amazed. I'm very interested in what you are doing. My God, somebody out there that is watching this program, remember you can enhance your outlook. You can. Dr. Yanni Van Logan is here to help us regain our beauty. And if in case you think you are out of proportion, please, that's why we have this. Is it a modern type of medicine now?
Well, this is a very quickly evolving part of medicine, and we are
It's
in
really
a
evolving. Yes, it's true.
yeah. This is a very very special time because I'm as you said, I'm the vice chairman of the Dutch Society of
Yes.
Aesthetic Medicine, and
Yes.
I'm doing a lot of
Research.
work for them. It's basically volunteer work, but it's so important for me that that there is a, let's say, a quality assurance for the audience, a quality assurance to know that if you are a patient and you want to enhance your beauty, you go to a clinic, and the website is beautiful. There's maybe the bio of the doctor who says he's the best, but how can you know that you're going to the right person?
Exactly.
So, with our society, we believe that it was important that that we create a new medical specialty. It's a profile specialty, and so I've been working so many hours over the last years to create a 2-year curriculum. Is kind of a, it's actually according to the official structure of a medical specialty course. So we are almost there now.
Okay.
We've been doing it together with different societies of other medical specialties like plastic surgery. They did a lot of work with us in the beginning until a few months ago. And also dermatology, ENT, ophthalmology.
Yeah.
Am I forgetting one? Yes, maxillofacial surgery and the Dutch Society of Cosmetic Surgery.
Yes.
So we were one group, and we were all thinking about what should we put into this curriculum and how should it be formed. And together with educational specialists from the AMC
Yes.
hospital,
And
we have now written the curriculum, and it's done now, and we have sent it to the, let's say, the authorities that have the power to register a new medical profile specialty. So this is super exciting times.
So this sort of medicine is only here in only here in the western part of the world. Has it reached Africa?
I know that it's in South Africa.
In South Africa?
Yes, that's quite Western actually. So of course it's African, but
Yeah.
But there's and definitely there it's in Africa and definitely in Egypt, but the other countries I'm not really sure how big it is. I thought you said that there's a lot of demand in Nigeria.
Because I think you will really excel tremendously in Africa, in West Africa. Because I believe Nigeria is one of the most populated African country. So if you bring your business there, for sure you will reach millions of people, because we are about 200 and something million population.
200 million. Wow.
Yes. So just one side of Nigeria, one aspect of Nigeria is just the whole Netherlands. So you
Exactly.
can imagine, yes.
Yeah, we're just like
Yeah. So we have the north, the south, the east, the west. So and there's this. I mean, it is an emerging market for your business.
So that's exactly what we want to do. This is the business development. I'm not a businessman, so my business partner, he is a businessman, and we are now working on. First, we want to be more present in other parts of the Netherlands. We are now opening a new clinic in the Zuidas in Amsterdam.
Where? South-Oost?
Zuidas.
Yeah.
Exactly.
Yeah.
And at a premium gym called Club Sportief, and it's a collaboration with them. Well, in a sense that we are in the same building as them. It's a very high-end gym, so we expect a lot there.
Okay.
And we're targeting, I mean, our target population is not just women, of course, but in the clinic in Amsterdam, in the center, we have about 14% men. But we want to have a much bigger percentage of men in the Southhouse, because we are doing it inside the gym, and of course we are there. There are so many men who are really interested in improving their looks, especially their body. And so they go to the gym, but they have this last little bit of fat.
Exactly, but let me ask you, or when you have removed the fat in the belly, can it come back?
Yes. Well, the fat that you take out cannot come back.
Yeah, but
the fat that remains, that can, it will never be
as
as
it
big.
was before.
No, but it can get a little bigger. Yes.
Are there some restrictions attached?
What do you mean?
I mean, like, do you still need to eat the same thing you are eating or after the removal of the fats, you will be placed on a special diet or?
Yes. If we remove the fat for transplantation, for example, we take the fat and we want to inject it into the breasts or into the buttocks or into the face, then I put my patients on 1 month high-calorie diet.
Okay.
So that means eat a lot of pasta, eat a lot of bread, and then the fat, that is being transplanted will have a lot of food, and it's going to be more easy to survive.
Okay.
And it's going to be more easy for that fat to really stick. The device that I was referring to earlier with the water spray, we've invested in this machine because it's the best machine for survival of the fat cells. Previous lipofilling techniques, they had about 50% of survival of these fat cells, but now we are at 80. So this is a big advantage, a big advancement, because where I would tell my patients earlier that they need at least 2 surgeries to get the right result.
Yeah.
Now, in a lot of times, only 1 procedure is enough.
Really?
Yes. Sometimes 2, but that depends on the wishes of the patient.
But let me ask you boldly, really, is this whole thing, is it affordable for an average person, or is it only meant for those who have enough capital?
It's not cheap.
Okay.
But for a lot of people, they are so happy with it. It's about quality of life.
They get back their look.
Yes, and that gives such
satisfaction,
such a boost in self-esteem.
Yes.
And it changes the way that they are in their lives, how they approach people, how productive they are at their work. If you feel really good about yourself, then that has an effect on the rest of your life.
It's true.
So I guess it is expensive. I mean, for example, the lipofilling of the let's say to remove the fat here, to transplant it and go to the buttocks or the breast, that costs 4,000 euros.
But it's affordable then.
It's not tens of thousands.
No.
If you go to certain clinics in Miami, yes, you pay about 20,000. But no, we do more or less the same procedure with really the best equipment for that.
So
then 4,000 is relatively affordable.
It is very, very affordable. I don't think it is something I was thinking I will hear something more than that. I think it's very, very affordable for you to be confident again, get back yourself and do the things you want to do.
I see a lot of young mothers who've given birth to their second baby, and they see their breasts
flat
disappearing.
It's true. Disappearing?
And, well, it's becoming flat and sagging.
Yeah, sagging, yes.
And it's mostly because of volume loss and also laxity of the skin. And for them, it's to feel feminine and to feel confident and proud of themselves. It is so worth it to enhance the breast with their own fat.
Yes.
A lot of people don't want to have silicone implants.
No.
Even though that does a great job. We have a very, very good surgeon that is truly specialized in breast
silicone
augmentation with implants, with silicone implants. And he does also amazing work with very natural results, with natural shaped implants. But with fat, it's your own tissue.
Okay.
So for a lot of people, that idea of
Yes.
the fact that it's their own tissue,
Yeah.
no plastic.
Yeah, I think one will feel more comfortable.
Yes, for a lot of people, that's a big advantage. Plus, you get rid of a little bit of problem fat in some areas that you don't really like.
Exactly.
Yeah, so it's a double double advantage.
Any question from Apostle? Do you have something to say? Because you are so quiet. Okay. So, how can one get some nice curves, like the breast, the backside, the belly? And
So we're talking a lot about the body right now, but actually we're supposed to talk about the face.
I'm so excited.
Actually, maybe just to finish, maybe you can show the before and after pictures of the buttocks and the breast. So this is an example of
wow, man! Which one is this? I love that one. You know.
So it's almost like mother and daughter, right?
Is that the mother and the daughter, or the same person?
No, it's the same person. And go to the next one.
Oh,
and,
really?
And you can see here, and this is a very natural, beautiful result.
All right. What is the difference here? Because I can't really find any difference.
No,
please.
look at the breasts.
That's what I'm looking at.
On the left image, you can see that the breasts are a little bit deflated, and on the right image, you can see that they have more volume and they look up more.
Yeah. They have more volume.
Yes, this is actually a patient of my colleague, Dr. Joop. Yeah.
They have more volume. It's true.
It looks more like a younger woman.
Yes, exactly.
Where
the right one. The right image, yeah.
Yeah, it's bigger. Yeah, it's true. Really.
So
fats can be taken from one side and then transported to another side.
Yes.
But what about the face?
Exactly. So with the face, you wanted to know, where do I put the fat?
Exactly.
So can I show in your face?
Yes, please.
Okay. Of course, you already have quite good volume. So, but what I see with the normal aging, and you can see it a little bit in your face, you can see here a slight concavity of the forehead. You see that there is a little depression here. So, as human beings, we look at faces.
Yeah.
Every day, all day long.
Yeah.
So we have become experts, every one of us, in estimating age.
Okay.
We look at a face and we know, wow, this person is in 20s,
yes,
or this person is middle-aged, or this is an older person. We can know it. We know it immediately. And it's because subconsciously we register all these signs of aging.
Yes, okay.
You don't know it, what you actually register, but this is one of the signs of aging that you subconsciously see. And it subconsciously makes you decide or estimate this person is of a certain age.
Yeah.
The same goes for the temples. Well, you have very nice full temples, but you see with a lot of people it becomes very hollow, giving a little bit of a skeletonized appearance. And if the hollower it gets, the older the person will look.
Really?
So these would be typical places where I would inject fat or fillers. Then, if you look at the eyes are actually, I think the eyes are the most important area of the face.
Yes.
They are the trickiest area because of the anatomy around the eyes.
Yes.
And to be treating this area, you really have to know what you're doing. Okay. So this is the most advanced area of the face, but the most important one.
Yes.
What we've learned from medical research is that the orbits, the bone, is becoming wider. So there's the bone, the hole in the skull, which is the orbit, is becoming wider. So that will make the eyes look hollow. So there's a hollowness coming here on the top of the eye. There's a hollowness here, and there's a hollowness here.
Yeah.
So these are typical places where I would place some volume, and that will rejuvenate the eyes. You don't see it, but it will make a person look younger.
So,
how long does the filling
How long? Yeah, that's what I want to ask too.
So fat will last for years. That can last 10 years or more. It's probably going to be permanent, except the fact that you will be aging as well. So the anatomy will change again. Fillers will last for a shorter duration of time. Fillers are actually much more popular because
Fillers,
you
okay.
you don't really have downtime. Maybe a little bruise, maybe a little bit of swelling for 1 or 2 days, but that's it.
Yeah.
With fat, of course, there's a whole procedure of harvesting the fat, and then after the treatment, you are swollen for 2 weeks or something.
Really?
So you have a swollen face, like you've been beat up.
Really?
And but with fillers,
But what do you recommend? As an expert, what do you recommend?
it depends on what you want as a patient. If you think to yourself, okay, I have a limited budget, and I don't want to come back every year because the fillers will last you about 1 year.
Okay.
If you don't want to come back every year, then choose fat.
Fat.
But if you think, and actually that's something that I would recommend, the combination might be good. You know, if somebody has a lot of volume loss, then I would say first do fat,
Fat.
come back after 3 months, we'll have a look. Then if we need fillers, we only need a little bit, just to improve it to the little dots on the eye.
So the fat and the filler, do they cost the same amount?
No, if we do a big treatment of fat lipofilling, it's a fat transplantation to the face, it will cost 3,500 euros. And for the fillers, depends on how many milliliters I use. Generally, per milliliter, it's about 500 euros. And on average, I think we have some combination packages. And we have the small package is 950 euros, and it contains 2.5 milliliters of filler. And there's another one of 1,450 and another one of 1,950 euros. And the one of 1,950 contains 8 milliliters of
But the
of
advantage, the disadvantage of the filler is that it is for a shorter duration. So you will be doing it maybe annually or every 2 years, probably at most.
every year.
Every
or,
year.
or even you come probably even more often because the combination treatments also have botulinum toxin.
I don't know that.
And that's what everybody knows by Botox.
Botox, yes.
And Botox you inject in, let's say, dynamic wrinkles, the frown lines, the crow's feet, the forehead lines, to relax the muscles.
Yes.
And that lasts only 3 months. So a lot of my patients, I see them every 3 months when they come back for their Botox treatment. And a big advantage of fillers is that it is not only volume.
Yeah.
The fillers have gone through such an amazing scientific development that the gels themselves have become very special. They have all these properties that are giving me such a lot of
satisfaction.
Yes, exactly. Such a lot of capacity of really sculpting the face. So if you don't want to have a lot of volume, but you just want to have a little projection here in that sexy spot in the cheek, I just put a little filler with a specific characteristics. I put it here, and you can see that very nice light reflection that enhances the golden ratio in the face.
Really?
With fillers, you can do very superficial injection. Let's say the lines here.
Yeah.
And with fat, it doesn't really work that well because fat does not really have a good viscosity.
But let's assume after 3 months you have done a filler now on me, and then after 3 months I have to come again.
No, after about 1 year you have to come again for the filler. Yes.
So what about if you do not have the chance of coming again? So the whole thing will collapse.
It will slowly go down and take you back to where you came from.
It's not only taking.
It's
it will be worse.
No, it will not be worse. It's not like
It's not taking back
so
from where you came.
it's you're going back to baseline. It's not gonna be. A lot of people think that. Why do people think that? It's like.
Oh my God! Take you back. This is very funny. So all the money you have invested in become becomes nothing.
Exactly.
You only had it for that couple of time, to just
Yes. Yes.
look beautiful.
Yes, for 1 year, and then it slowly disappears. So you have to,
Verify, yeah.
you have to be retreated. And there's also products.
Then do you do that?
No, if I tell you about the alternative, then you understand.
Okay.
Because there are products that are permanent products that don't dissolve over time. They stay in the tissue.
Yeah, okay.
A friend of mine just did a PhD thesis on filler complications after permanent filler injections.
Yes.
Oh my God, if you look at how horrible the faces will look after they get in trouble with permanent fillers, you never want to risk it.
Really?
And these people have permanent problems. They look horrible. They have nodules and lumps, and sometimes the skin just opens with pus.
Hey.
And so these are products that I would never inject in my patients. I would inject only safe products that dissolve over time. Safe products that the body can metabolize and get rid of.
It's terrible. This other side, I don't think anybody would like to.
Yeah. So
hear it.
you prefer to come back after a year for a retreatment than having a ticking time bomb in your face.
Wow, this is so good.
Yeah.
Well, yeah, we've really exhausted our time. Before we sign up, what do you think? How can you be contacted, Dr. Jorgen?
My clinic is called Doctors Inc. It's www.doctors-inc.com. Doctorsinc.com.
Yes.
And I'm in Amsterdam.
So when they go to the website, Dr. Yanni, they will see your telephone number and then they can call the clinic.
Absolutely.
Right. And then they have to know that it is affordable. Now, before we sign up, can you look into the camera and tell somebody who have watched us something that can make them to come to you?
Well, we believe in a very personalized treatment plan.
Okay.
The most important part of any treatment at my clinic is the consultation. We give you all the time that you need to explain what you want, and then I will take my time to explain what I can do to help you.
Yes.
And then together we will devise a very personalized treatment plan, and we will probably be seeing each other more, because what I've seen is that people become so happy with themselves and with the way they look. They realize that they want to continue improving their face and improving their looks and the quality of life.
It's true. Thank you so much, Dr. Yanni van Logan, for being with us.
Thank you.
I've enjoyed this season, and at the same time, I feel a little bit threatened. I don't know why.
Threatened? I don't have any needles in my pockets.
No. I'm so impressed on what you are doing. I'm so humbled because I didn't know that such a person is around me, and then I'm so delighted that you are contributing a lot to humanity, and may God richly bless you.
Thank you so much.
Yes.
I'm humbled to be in your presence as well, because I know what you're doing to the community, and I think it's amazing.
Thank you so much. So those who have just watched this program, it has been a very wonderful time with Dr. Yanni van Logan of the Doctors Inc. And then remember that he is an anesthetic physician. I don't know why I have problem in pronouncing aesthetic physician. That's who he is, not a plastic surgeon. Aesthetic physician. So when you want to improve any part of your body, the breast, the face, the belly, the backside, please remember Dr. Yanni van Logan is the best for you. So we hope that you will tell your friends about this wonderful experience and get in touch with Dr. Yanni. God bless you. We
Thank
see you
Anna.
again and again and again.
I'll come back.
Thank you. So keep watching Majesty TV and bye for now.
Thank you.